Welcome back to Africa Science Focus, the science and development show from SciDevNet. I'm Ogechi Kianyang. In this episode, we're tackling the state of African healthcare. Despite progress, many healthcare systems continue to struggle with poor infrastructure, a high burden of infectious diseases, and severe workforce shortages. According to the World Bank, several African countries have fewer than 2.3 healthcare workers per 1,000 people. Could artificial intelligence help transform healthcare in Africa? AI is already proving to be a powerful tool for improving accessibility, diagnostics, patient care, and overall health management. In this episode, we'll explore the adoption of AI in Africa's healthcare system, its potential to improve accessibility, and the future of AI in healthcare systems on the continent. Our reporter, Michael Kaloki, has been speaking with African healthcare innovators who are leveraging AI to tackle critical healthcare challenges. First, we hear from Charles Waka, Senior Advisor of Digital Innovations at Pathfinders International. His organization is using AI to optimize resources for neonatal and maternal healthcare in Nigerian communities. He explains how AI is helping to improve health outcomes for mothers and newborns.
So, Pathfinder, as an organization, we deal with aspects of the public health. So, working with the community, working with the service providers, working with the governments in order to improve upon the public health of the people that we serve. So, one aspect of AI tools that Pathfinder has found useful has been on data analytics. And so when you talk about data analytics, we talk about flagging areas where health issues might be emerging, assisting to help direct resources where they are needed the most. A good example that I can give is for Nigeria, where we are implementing RMNCH program called geospatial mapping, in which are integrating the use of GIS and artificial intelligence in order to optimize the resources that we have for reproductive and maternal neonatal child health in 3 states in Nigeria. And so using the data that is generated from the GIS, we have a partner who works on the AI front, Data Science Nigeria, who now are able to create artificial intelligence models that can be able to use to optimize the data that is generated from RMNCH. This data becomes important when you want to reach and target clients that are unassisted, that if you did not analyze this information as it came by, they are missed through the normal channels of receiving services. And so it allows you to identify under-resourced and underserved populations, and then optimize the resources that you have at the facility, be able to target and serve the clients who are in these underserved population areas.
Thank you, Charles. What impact have the tools had on the delivery of your health programs?
So in terms of the impact, so we can talk about 2 things. Program delivery, right? So by using these AI tools, I believe the program can focus on achieving better quality outcomes for the people that they are serving. And you can also be able to direct resources where they are needed the most. So it means you have fewer delays in care and also better outcomes for our clients/patients. So at the end of this all, the programs or the projects that we implement will become more efficient and effective, and we believe it may lead to earlier interventions and improved patient care and satisfaction.
Now, how significant is the role of national governments on the continent in advancing the use of AI in the health sector?
In all of these discussions that we've had, the government becomes very essential, especially when you want to set the stage for a very successful AI adoption. And so they are absolutely crucial. So think about it, yeah? The government sets the policies and they set up the regulations that will ensure the AI tools are used ethically and effectively, right? And so they need to do that, because without policies and regulations, you cannot be able to implement, right? And so that's one part. Another part is infrastructure. So the governments can invest in setting up reliable internet connectivity, so bridging the digital divide, enabling consistent or stable electricity, because power is key for AI. Having robust healthcare IT systems. And so if they have facilities, they can help in modernizing and updating their IT systems. And all of these are foundational and key for setting up, there's foundational and key for a successful adoption of AI.
Thank you, Charles. Finally, are there ethical risks that could arise when deploying AI in African healthcare, and how can they be mitigated?
The first thing that you always think about ethical risk has been bias within AI systems, right? And so most AI systems that have been trained on, the data may not be representative of the community that you are serving, right? And so it means based on what it knows, it can unintentionally favor certain groups over others, or it can give inaccurate information about certain groups. And so that is a very huge ethical risk. Privacy concern, right? Because you're handling sensitive health information, right? And so all of this comes with its own inherent risks of either the data being breached or potential misuse of your data. And then lack of transparency. And so sometimes nobody really understands how AI works, right? It may put out its response, it may come up with its own solutions or conclusions, but how can you make it accountable for the process it undertook in order to come up with its solutions, or how it came up with it? And so they are not that transparent. The so-called algorithms, they are not necessarily transparent, and so it does not lend favorably to accountability.
Also working in AI healthcare space is Ndisha Mwakala, Chief of Party at Digital Square in Kenya. Previously as a Health Information Systems Advisor at the Centers for Disease Control and Prevention, she collaborated on an AI project aimed at enhancing HIV case finding and diagnosis. She tells Michael about how AI is improving detection and treatment for HIV patients.
So I've spent the last, I believe, 15 years of my computer science work in health. So making sure that there are systems that can support health programming in Kenya. When I joined the Centers for Disease Control back in 2017, I noted that we clearly have a gap and a problem that we need to solve. And one of the models that we developed, which is supposed to support the case finding in HIV diagnosis of patients, was solving a problem where with funding going down, we're being told you need to find all the positive people or people who are HIV positive in Kenya, but with less money, so with less testing. So with that, you have to think about how do you optimize these processes? How do you improve efficiency? How do you make sure that the number of people you finally test are actually the best people to be tested and those who you will get your positives from? So with more discussions came up the fact that we have artificial intelligence, we have machine learning models which can predict to a point, like how positive this person could be or how the risk of being positive for this person. So that's what we designed. So and I have to give a shout out to the team that I was working with. I didn't do this alone. I was at CDC, but they're very smart engineers from Palladium who are doing the actual coding. So shout out to Bernadette Otieno and Yoni Friedman, amazing engineers. So who wrote the actual algorithms that then would do what? Would be trained. So machine learning is basically a subset of AI where you write algorithms, you give the algorithms data, and train the algorithms based on this data to be able to perform very complex tasks. So the task in this case was to risk stratify. So we are classifying patients based on their risk. We had 4 risks. So is the patient very high risk or just high risk or medium risk or low risk in terms of them being positive? So based on that, then you use this information. So let's say I had 50 people coming into my clinic. Of those, only 5 were categorized as very high risk. You quickly then can start testing them and see, are they turning positive? And most of the time we found that those who are categorized as very high risk and high risk were turning positive. So the yields out of that testing process was more.
What challenges did you encounter, when developing this tool?
And I believe these are basically the challenges that we have been facing, especially starting in 2018, 2019. Just lack of structured, clean, and quality data. All AI, all machine learning require data to be trained. And with no data, and especially data for Africa, that we have generated in Africa to be used for models that talk about or, predict about African people was lacking. And then another challenge was competing resources. The model of digitization in Kenya for public hospitals is that we have servers that are on premise, so they are in the health facility. Most of the time, it's just a simple desktop. Now, that desktop is being used for everything else, and then is also hosting the electronic medical record, and then you come and also put in your model. With time, the system is very slow, and, you have users complaining. So just those issues with computing resources. Then the other, I think, challenge I would want to mention was just embedding this whole thing and making it acceptable. So we call it change management to the users.
What can innovators such as yourself do to ensure that these tools are accessible to rural communities on the continent?
That's a good question. And it's something that I think a lot about, because the more we are, evolving with AI, the more we are leaving a whole lot of people behind. And so we are increasing the digital divide because they are not accessing what we are building. But I believe, and especially in the health sector, we do have a solution for this. We have for example, in Kenya, we have over 10,000 community health workers who have now been digitized, like their services have been digitized, and they have access to smartphones that they can go around to households everywhere, including in rural Kenya, and educate people, socialize them to the solutions that we have, so that, a mother who has, I don't know how many babies, is not seeing some of these things for the first time. They're able to know that these things are available. Also, socialize them to things like telemedicine and say, in sub-county referral, in sub-county hospital X, we do have telemedicine, and this is what telemedicine is. If you go there, you can see what we would call Daktari Mkubwa, who is from, Kenyatta University or referral hospital, or who is from Nairobi Hospital or something like that. So socializing them through people they trust, rural people trust their community health workers. I think that's one thing we can do. Another thing we should do is to leverage technologies that are already using simple things like a mobile device that is not smart. So make sure that we have multi-channels for our systems on our platforms, AI platforms, to be accessed. That way you're not closing out people who can only SMS or people who can only share information via voice. And there are people who are making this very accessible. Technologies like Viamo have made this possible. So you can actually have a digital survey using a phone that is very easy. We call them the feature phones. You can have a mother dial in and ask about family planning just using SMS or USSD.
AI is also playing a role in vaccinology. Zakia Salod, a South African researcher in medical AI and bioinformatics, has been exploring this field extensively. Zakia's PhD research led to the development of Vaccine 8, an AI tool designed to accelerate vaccine discovery. Using reverse vaccinology, it analyzes the pathogen's genome to predict potential vaccine candidates, streamlining the development process.
So Vaccinate takes a viral protein sequence as input, and then it uses machine learning to determine whether the protein sequence from a viral pathogen, whether it is a potential vaccine candidate, so whether it's an antigen or not. So the ones that I predicted to be potential vaccine candidate, it can be used as information as a basis for vaccinologists to try out in the lab. And then that streamlines the process to work towards creating and developing a vaccine, because it's data-driven instead of like trial and error, trying out different proteins from a virus, which happens traditionally in the lab.
Now, how exactly then would it be used, say, by those in the medical field?
Good question. So as I mentioned, whatever protein sequence from a viral pathogen. So for example, for COVID-19, it will be the SARS-CoV-2 pathogen. So that virus is being input into the Vaccinate tool. You could whichever of those protein sequences from all that's input is output as predicted from the Vaccinate tool to be a potential vaccine candidate. So those ones will be filtered out, and that information will be given to a vaccinologist, and then the vaccinologist would know to use that particular protein sequences like a subset, and then try it out in the lab. So do the mice model assays, and then try it out and then after that is successful, it goes on to clinical trials, and then that streamlines the process of trying to develop a vaccine.
Is Vaccinate currently in operational use? And if so, who exactly is using it?
So that's a good question. So actually, currently it's not in operational use, because I'm currently addressing journal reviewer feedback, and I hope to make it publicly accessible soon. So after that process is completed.
Oh, thank you. Now, what challenges, Dr. Salod, did you encounter when developing this tool?
Okay, so the biggest challenge that I encountered when developing Vaccinate was the lack of publicly available data sets for training machine learning models on viral pathogens, so different viral pathogens. I found that most data sets were buried in supplementary files of research papers with no clear documentation on exactly how to create these data sets. So to overcome this, I curated a data set of antigenic and non-antigenic viral protein sequences, so potential vaccine candidates or not. And then I made it so it was one of the first data sets of its kind. I published it in a research paper, and I also detailed the data set and the computational steps to actually generate that data set. This challenge is common in AI-driven medical research. So high-quality curated data sets are scarce. But as Albert Einstein said, in the middle of difficulty lies opportunity.
AI tools like Morami detect breast cancer and other diseases early, giving patients a better chance at timely treatment. Darlington Akogo, founder and CEO of Minor Health AI Labs in Ghana, explains how AI-powered screening helps doctors analyze medical images more accurately and then improves patient outcomes.
Minor Health AI Labs is essentially an AI for health company. We started it with the objective of democratizing access to quality healthcare. And so what that means is that essentially we build AI solutions for healthcare. Currently, we have one big AI system that is called Moremi. This is a generative AI platform. So within this one AI system, it does everything like screening diseases, diagnosing diseases, prognosis, treatment planning, and then even prescription. And it can do this for over 200 different diseases. So this AI system is used, for example, to help, let's say, medical doctors be able to analyze mammograms to detect breast cancer, and then it can help them write medical reports. So it supports everything, both text, lab data, medical images. We support over 25 different types of medical images. But it's not only used by medical doctors, so even the general public can use it for medical education. So, for example, if there's something wrong with you and you're not sure, you can ask the AI system, provide your symptoms, and ask it, what is wrong with me? And it can give you a list of possible things that is wrong, and then tell you which doctor you should go see. So you can say, based on your symptoms, maybe you should go see an oncologist. Maybe that's a very severe case. We're talking about cancer in that case. But if it's something minor, it might say, go see a general practitioner, go see a nurse, or go see an orthopedic specialist, because it looks like you might have some issues with your bone. And then you could go to your doctor and present that. But if it's something minor, it might just say that, looking at your symptoms, probably you just need more rest. So take a nap, and then the pain or the headache is going to go away, or maybe avoid where you are applying the pain. So we do all of that, and then we go into the actual biology of things. So we leverage Moremi, what we call Moremi Bio, and then Moremi Bio agents, which we just recently announced. We're using it to design new drugs, new antibodies. We recently just partnered with an institution called Waka. It's one of the leading biolabs on the continent. It's a global leader within the biospace, backed by the World Bank and other big funders. So we partnered with them, and then we use our AI system to design new drugs for malaria.
Thank you, Darlington. And I understand that part of your motivation to found Health came about you sort of being tired at waiting in line at hospitals or clinics.
Yes. So it's very frustrating to go to the hospital, especially when we're talking about public facilities on this side of the world, right? You can go there and sit there for hours, just waiting, especially if you want to see a specialist, because we don't have enough specialists within our country. So if you take radiologists, like this, the entirety of Ghana only has 100 radiologists. This is for a population of 30 million, right? So, and radiology is a key part in healthcare. So if you needed to go see a radiologist or have them interpret your medical images, it could take forever. And in healthcare, every minute counts.
What feedback have you received from those who have used the AI systems, the AI tools that Minor Health AI Labs has developed?
So we can even divide it into 3 segments. So we can start with the doctors. For the doctors, when you tell them about the AI system before they try it almost sounds too good to be true. Essentially, for example, if you tell it that the AI system can look at a medical image and generate a draft medical report for you in like 2 seconds, they're like, yeah, I don't believe that. And then they try it and they're like, oh my goodness. So we have facilities that are telling us that like, this is helping us to be able to detect cancers like breast cancer, nodules and things like that much faster, because there's a shortage of radiologists. We have like some of the projects we are implementing, they're like, to get an answer like this without this AI system will require you keying, waiting for a doctor forever. And now you can get it in a few seconds. So the amount of benefit is tremendous on that end. On the patient end, it's also basically a bit similar. People get surprised. Like, for example, I think the dermatology one actually surprised a lot of people. The first time we even noticed the dermatology use case, someone asked us that, I've been getting these rashes and everything. Like, and we're like, just take a photo and run it through the AI system. And they did it, and it got a bunch of suggestions, and then they tried it, and they were shocked that it actually worked. So we get all these experiences where people underestimate like how far technology has come in its ability to play a role in healthcare delivery. So there's that shocking period where they're like, the AI system can actually do this. But the biologists are also super surprised, right? When we realized that we can design drugs with Moremi Bio, we contacted some biologists and then we gave them an example and they're like, but maybe it's generating and you need to be able to validate it. And usually they validate this computationally using like 3 different mechanisms. And then we came back in a couple of weeks and we told them that, the AI system can validate its generation, not with 3, but with 15. So 15 different ones, which is about 5 times more than what they even traditionally do. And that's for antibodies. We have the more traditional type of drug, which is collectively called small molecules. We use over 60 metrics. So they looked at the results and they're like, wait, the AI system did all of this. Like, they're like, this is a game changer. So yeah, it's very amazing just getting the feedback from different parts of the world on how the AI system is helping to improve healthcare.
AI can transform healthcare in Africa, but progress depends on more than just innovation. Usman Alam, Program Lead for Science Policy Engagement at the Science for African Foundation, discusses why funding and policy support for AI-driven healthcare solutions are essential to improving medical outcomes across Africa.
Any person following the AI debate right now is aware that, the scope of AI innovation in Africa health sector is one that's rapidly growing. And in fact, some, consider it second to fintech. And again, the spectrum of how AI can be deployed within the health sector is cross-cutting across the value chain, anywhere from clinical applications to health system management to health policy and also community health initiatives, right? And then in terms of support, there are a number of initiatives. So for example, here we at the Science for Africa Foundation, through initiatives like the Grand Challenges, playing a critical role in nurturing these AI innovations and innovators in health. And we currently have a portfolio of 17 grantees across Africa with seed funding of up to 100,000 for 1 year, where we, allow the Grand Challenges Africa allows them to provide a platform for collaboration, helping innovators translate their ideas into impactful solutions. And again, some of the innovations, go anywhere from clinical decision-making support tools to a grantee working on AI-powered tools for early detection of diseases such as tuberculosis, targeted communication tools that bridge language and literacy gaps, and then even AI-driven chat box. But, beyond these initiatives, I think it's really critical to appreciate the role of African countries and regional economic blocs and even, the AU in recognizing the critical importance of investment in responsible and ethical AI for healthcare in Africa.
And that's all from us at Africa Science Focus today. If you want to find out more, head to the SciDevNet website. That's www.scidev.net. Today's show was produced by Alice Hurst, with editing by Titi Lokwe Fadare and Ogechi Ekeanyawo. Reporting was done by Michael Kaloki. I'm Ogechi Ekeanyawo. Until next time, goodbye. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station. This podcast was supported by the Science Granting Council's initiative, which aims to strengthen the institutional capacities of 18 public science funding agencies in sub-Saharan Africa.